You're tired all the time. Your hair is falling out more than it should. You're gaining weight even though you haven't changed your diet. And no matter what you do, you just can't seem to figure out what's going on with your body. Sound familiar? Hey everyone, I'm Dr. Michael Richardson, a nutritionist who helps people balance their blood sugar, improve their metabolic health, and understand their bodies on a deeper level. And today we're talking about something that affects millions of people but almost never gets discussed in mainstream health conversations. I'm talking about iodine deficiency. Now, if you watched my last video on thyroid health, you know how critical this little gland is for literally everything your body does. Your metabolism, your energy levels, your brain function, your hormones, everything. But here's what most people don't realize. Your thyroid can't do its job without iodine. It's like trying to drive a car without gas. Doesn't matter how nice the car is, it's not going anywhere. And the biggest misconception I see out there, the one that keeps people stuck and frustrated, is this idea that if you eat a normal Western diet, you're getting enough iodine. People think, oh, we have iodized salt, so iodine deficiency must be a thing of the past, right? Wrong. Dead wrong. And I'm going to explain exactly why that thinking is keeping you from feeling your best. First, let's talk about what iodine actually does in your body, because once you understand this, everything else is going to make so much more sense. Iodine is a trace mineral. That means you only need small amounts of it, but don't let that fool you into thinking it's not important. This mineral is absolutely essential for the production of thyroid hormones, specifically T3 and T4. These hormones are like the conductors of your metabolic orchestra. They tell every single cell in your body how fast or slow to work. Think of it this way. Your thyroid is like a thermostat for your entire body. It controls your metabolic rate, which is basically how efficiently your body burns fuel and produces energy. When your thyroid is working properly with enough iodine, everything hums along beautifully. Your energy is stable, your weight stays balanced, your brain feels sharp, your mood is good. But when you don't have enough iodine, that thermostat starts malfunctioning, and that's when all those frustrating symptoms start piling up. Here's the thing that blows most people's minds. Your thyroid uses iodine to make two main hormones, T4, which has 4 iodine molecules attached to it, and T3, which has 3. T4 is like the storage form. It's relatively inactive. Your body has to convert it to T3, which is the active hormone that actually does the work. And both of these hormones require iodine to be synthesized in the first place. No iodine, no thyroid hormones. It's that simple. But it gets even more interesting. Iodine isn't just important for your thyroid. It's also critical for other tissues in your body. Your breasts, your prostate if you're a man, your ovaries, your brain, they all need iodine to function properly. In fact, about 30% of the iodine in your body is stored in tissues outside your thyroid gland. So when we talk about iodine deficiency, we're not just talking about thyroid problems. We're talking about a system-wide issue that can affect multiple aspects of your health. Now, let's get into the signs that you might be deficient. Because here's the tricky part. Iodine deficiency doesn't always show up in obvious ways. It's not like you wake up one day and think, oh, I must need more iodine. The symptoms are subtle. They creep up on you. And they often mimic other conditions, which is why so many people go years without realizing what's actually wrong. The first major sign is unexplained fatigue. And I'm not talking about being tired after a long day at work. I'm talking about that deep, bone-tired exhaustion that doesn't go away no matter how much you sleep. You wake up tired, you're tired all day, you go to bed early, and you still wake up tired. This happens because when your thyroid doesn't have enough iodine to make adequate amounts of thyroid hormone, your metabolism slows down. Your cells aren't producing energy efficiently. It's like trying to run your whole house on a dying battery. Everything works, but everything works slowly and weakly. And here's what frustrates me about this. So many people go to their doctor complaining of fatigue, and they get told it's just stress, or they need to exercise more, or maybe they're depressed. And sure, those things might be contributing factors, but if the underlying issue is iodine deficiency affecting your thyroid function, no amount of stress management or exercise is going to fix the root problem. You've got to address the deficiency. The second major sign is weight gain that doesn't make sense. You're eating the same foods you've always eaten, maybe you're even eating less or exercising more, but the scale keeps creeping up. Your clothes feel tighter, and you feel like your body has completely turned against you. This is classic hypothyroidism, which is what happens when your thyroid isn't producing enough hormone. And one of the most common causes of hypothyroidism worldwide is iodine deficiency. Your thyroid hormones regulate your metabolic rate. They tell your body how many calories to burn at rest. When you don't have enough thyroid hormone because you don't have enough iodine, your metabolic rate drops. Your body starts burning fewer calories. And even if you're not eating any extra food, those unburned calories get stored as fat. It's incredibly frustrating because it feels like you're doing everything right, but your body isn't responding the way it should. The third major sign is hair loss. Now, everyone loses some hair every day. That's totally normal. But when you start noticing more hair in your shower drain, on your pillow, or when you run your fingers through your hair, that's a red flag. Thyroid hormones play a crucial role in the health of your hair follicles. They regulate the cycle of hair growth and shedding. When you're deficient in iodine and your thyroid hormone levels drop, your hair follicles can enter a resting phase prematurely. This means less hair growing and more hair falling out. And it's not just the hair on your head. Some people notice their eyebrows thinning, especially the outer third of the eyebrow. This is actually a classic sign that doctors used to look for in physical exams when checking for thyroid problems. If you're losing hair and nothing else seems to explain it, and especially if you're also experiencing some of these other symptoms, iodine deficiency might be the missing piece of the puzzle. The fourth major sign is feeling cold all the time. You're wearing a sweater while everyone else is comfortable in short sleeves. Your hands and feet are always freezing. You just can't seem to get warm no matter what you do. This happens because your thyroid hormones help regulate your body temperature. They do this by influencing your metabolic rate and something called thermogenesis, which is basically your body's ability to generate heat. When you're low in iodine and your thyroid hormone production drops, your metabolic rate drops. Your body starts burning fewer calories. And even if you're not eating any extra food, those unburned calories get stored as fat. It's incredibly frustrating because it feels like you're doing everything right, but your body isn't responding the way it should. The fifth major sign is brain fog and difficulty concentrating. You walk into a room and forget why you went there. You're reading the same paragraph 3 times and still not absorbing it. You can't seem to focus on tasks the way you used to. Words are on the tip of your tongue, but you just can't quite access them. This is incredibly frustrating, and it's more common than you might think with iodine deficiency. Your brain is a massive energy consumer. It uses about 20% of all the energy your body produces, even though it only makes up about 2% of your body weight. That's a huge energy demand, and thyroid hormones are critical for brain function. They help regulate the production of neurotransmitters, those chemical messengers that allow your brain cells to communicate with each other. They also support the formation of myelin, which is the protective coating around your nerve fibers that helps signals travel quickly and efficiently. When you don't have enough iodine and your thyroid hormone levels drop, your brain doesn't get the support it needs. Neurotransmitter production can be affected. Your neurons don't fire as efficiently, and you end up with that foggy, sluggish feeling where thinking feels like wading through mud. It's not that you're losing intelligence, it's that your brain doesn't have the resources it needs to function at full capacity. The sixth major sign is mood changes, particularly depression or increased anxiety. Now, I want to be clear here. Depression and anxiety are complex conditions with multiple potential causes, but thyroid function plays a significant role in mood regulation, and iodine deficiency can absolutely contribute to mental health struggles. In fact, there's a strong association between hypothyroidism and depression. Some studies suggest that up to 60% of people with hypothyroidism experience depressive symptoms. Here's why this happens. Thyroid hormones influence the production and function of neurotransmitters like serotonin, dopamine, and norepinephrine. These are the chemicals that help regulate your mood, your motivation, your sense of well-being. When thyroid hormone levels are low, neurotransmitter activity can be disrupted. You might produce less serotonin, which is associated with feelings of happiness and contentment. You might have less dopamine, which affects motivation and pleasure. The result is you feel flat, unmotivated, maybe hopeless or anxious. And here's what's really important to understand. If your depression or anxiety is being driven by iodine deficiency and resulting thyroid dysfunction, treating it only with antidepressants or anti-anxiety medications might help manage symptoms, but it's not addressing the root cause. You need to fix the iodine deficiency to truly resolve the problem. The sixth major sign is dry, flaky skin. Your skin feels rough and scaly, especially on your elbows, knees, and heels. You're constantly applying lotion, but it doesn't seem to help. Your skin just won't stay moisturized. This happens because thyroid hormones play a role in skin cell turnover. They help regulate how quickly your skin cells regenerate and shed. When thyroid hormone levels are low due to iodine deficiency, this process slows down. Old skin cells hang around longer than they should. New cells don't regenerate as quickly. The result is dry, rough, flaky skin that no amount of moisturizer seems to fix. Your skin also needs adequate blood flow to stay healthy and hydrated. Thyroid hormones help regulate blood flow to your skin and other tissues. When thyroid function drops, blood flow to the skin can decrease, which further contributes to dryness and poor skin health. So if you're dealing with persistently dry skin along with some of these other symptoms, it's worth considering whether iodine deficiency might be playing a role. The eighth major sign is irregular or heavy menstrual periods. For women, this is a big one. Your thyroid hormones and your reproductive hormones are intimately connected. They work together to regulate your menstrual cycle. When you're deficient in iodine and your thyroid hormone levels drop, it can disrupt your entire reproductive hormone balance. You might experience heavier periods, more painful periods, irregular cycles, or even absent periods. This happens for a few reasons. First, thyroid hormones affect the production and metabolism of estrogen and progesterone, your main reproductive hormones. When thyroid function is low, estrogen metabolism can be affected, leading to a relative excess of estrogen compared to progesterone. This can cause heavier, more irregular periods. Second, thyroid hormones influence the production of sex hormone binding globulin, or SHBG, which is a protein that binds to sex hormones and regulates how much is available to your tissues. When thyroid function is low, SHBG levels can drop, which can further disrupt hormone balance. And here's something that doesn't get talked about enough. Iodine deficiency can also affect fertility. If you're trying to get pregnant and having difficulty, thyroid function is one of the things that absolutely needs to be evaluated. Even subclinical hypothyroidism, where your thyroid hormones are just slightly low, can make it harder to conceive and increase the risk of miscarriage. This is serious stuff, and it's one of the reasons why ensuring adequate iodine intake is so important, especially for women of childbearing age. The ninth major sign is muscle weakness and aches. You feel weak when you try to lift things or climb stairs. Your muscles feel sore even though you haven't been exercising. You might have trouble with coordination or feel like your muscles just don't respond the way they should. This happens because thyroid hormones are essential for muscle metabolism and function. They help regulate protein synthesis in your muscles, which is necessary for maintaining muscle mass and strength. They also affect how efficiently your muscles use energy. When thyroid hormone levels drop due to iodine deficiency, muscle protein breakdown can increase while protein synthesis decreases. This means you're losing muscle mass faster than you're building it. Your muscles don't get the energy they need to function properly. The result is weakness, fatigue, aches, and sometimes even muscle cramps. And just like with the other symptoms, if you're trying to fix this with exercise alone without addressing the underlying iodine deficiency, you're going to stay frustrated because you're not dealing with the root cause. Now here's where things get really interesting, and this is something most people don't know. Even if you're using iodized salt, you might still be deficient in iodine, and there are several reasons why this is happening to more and more people today. First, not all salt is iodized. Sea salt, Himalayan pink salt, kosher salt, most of these trendy salts that have become popular in recent years don't contain iodine. People switched away from regular table salt thinking they were making a healthier choice, but they inadvertently cut out their main dietary source of iodine. And even if you are using iodized salt, you might not be using enough of it to meet your iodine needs, especially if you're trying to reduce your sodium intake for blood pressure or other health reasons. Second, the iodine content of our food supply has been declining. Soil iodine levels vary widely depending on where you live. In many areas, especially away from coastal regions, the soil is naturally low in iodine. That means the plants grown in that soil are low in iodine, and the animals that eat those plants are also low in iodine. Decades ago, iodine was commonly used in bread making as a dough conditioner. This provided a significant source of dietary iodine. But in the 1970s and 80s, the baking industry largely switched to using bromine instead of iodine. Bromine is actually a halogen, like iodine, and it can compete with iodine for uptake in your thyroid gland, potentially making iodine deficiency worse. Third, we're exposed to more substances that interfere with iodine utilization. These are called goitrogens because they can cause goiter, which is an enlargement of the thyroid gland. Some goitrogens are naturally occurring in foods like cruciferous vegetables, broccoli, cauliflower, cabbage, kale. Now, before you panic and swear off vegetables forever, let me be clear. These foods are incredibly healthy and you should absolutely keep eating them. For most people, the goitrogenic effects are minimal, especially when the vegetables are cooked. The issue only becomes problematic when you're already borderline deficient in iodine and you're eating massive amounts of raw cruciferous vegetables.
But there are other goitrogens that are more concerning. Bromine, which I mentioned earlier, is found in some baked goods, soft drinks, and as a fumigant on some crops. Fluoride, which is outed to most public water supplies, can also interfere with iodine uptake by the thyroid. Chlorine, which is used to disinfect water, is another halogen that can compete with iodine. Perchlorate, which is a contaminant found in some water supplies and foods, is a particularly potent inhibitor of iodine uptake by the thyroid. What this means is that modern life has created a perfect storm for iodine deficiency. We're getting less iodine from our food, we're using less iodized salt, and we're exposed to more substances that interfere with the iodine we do get. No wonder so many people are walking around with symptoms of iodine deficiency without even realizing it. Now, let's talk about who is most at risk for iodine deficiency, because certain groups of people need to be especially vigilant. Pregnant and breastfeeding women top the list. During pregnancy, your iodine requirements increase significantly because you're not just supporting your own thyroid function, you're also providing iodine for your developing baby. Your baby's brain development depends on adequate thyroid hormone, and that means adequate iodine. Iodine deficiency during pregnancy can lead to serious problems, including miscarriage, stillbirth, and cognitive impairments in the child. The American Thyroid Association recommends that pregnant and breastfeeding women get at least 250 micrograms of iodine per day, which is significantly more than the 150 micrograms recommended for most adults. But studies show that many pregnant women in developed countries, including the United States, are not meeting this requirement. This is a serious public health issue that doesn't get nearly enough attention. People who don't use iodized salt are also at higher risk. This includes people who follow low-sodium diets, people who prefer specialty salts like sea salt or Himalayan salt, and people who eat a lot of processed foods. Here's an interesting fact. Most processed foods are made with non-iodized salt, so if a significant portion of your diet comes from packaged, processed foods, you're probably not getting much iodine, even though you're getting plenty of sodium. It's the worst of both worlds. Vegans and vegetarians can be at higher risk, especially if they don't consume sea vegetables or use iodized salt. Most plant foods are not good sources of iodine unless they're grown in iodine-rich soil or near the ocean. Dairy products and fish are two of the best dietary sources of iodine, so when you eliminate those from your diet, you need to be intentional about getting iodine from other sources. People who live far from the ocean are at higher risk because ocean water and ocean air contain iodine. Historically, populations living near coastlines had higher iodine intakes from seafood and from the iodine that gets into the soil from sea spray. Inland populations, especially in mountainous regions, have traditionally had higher rates of iodine deficiency. This is one of the reasons why iodine fortification of salt was implemented in many countries to protect these at-risk populations. People with certain medical conditions are also at higher risk. Autoimmune thyroid diseases like Hashimoto's thyroiditis can affect how your body uses iodine. People with stomach or intestinal issues that affect nutrient absorption might not absorb iodine efficiently even if they're consuming adequate amounts. And certain medications can interfere with iodine uptake or thyroid hormone production. So what do you do if you're experiencing some of these signs and you're wondering whether iodine deficiency might be an issue for you? This is where we get into the action plan, the practical steps you can take to address this.
Step 1 is to talk to your doctor about testing your thyroid function. The most common test is a TSH test, which measures thyroid-stimulating hormone. This hormone is produced by your pituitary gland, and it tells your thyroid to make more thyroid hormone. When your thyroid isn't producing enough hormone, often because of iodine deficiency, your pituitary cranks up TSH production to try to stimulate the thyroid to work harder. So an elevated TSH can be an early sign of thyroid dysfunction. But here's the thing, TSH alone doesn't tell the whole story. You also want to test your actual thyroid hormone levels, free T3 and free T4. These tell you how much active thyroid hormone is actually available in your bloodstream. And if you really want a complete picture, you can also test thyroid antibodies to rule out autoimmune thyroid disease, and you can test for iodine deficiency directly through a urine iodine test. The urine iodine test is interesting because it measures how much iodine your body is excreting. If your body is getting adequate iodine, you'll excrete a certain amount in your urine. If you're deficient, your body holds onto iodine more tightly and you'll excrete less. The World Health Organization considers a urinary iodine concentration below 100 micrograms per liter to indicate iodine deficiency. Below 50 is considered moderate deficiency, and below 20 is severe deficiency. Now, I need to emphasize this. Do not try to diagnose and treat yourself without proper testing. Iodine is essential, but more is not always better. Taking excessive amounts of iodine, especially if you have certain thyroid conditions, can actually make things worse. This is why working with a knowledgeable healthcare provider is so important. Step 2 is to evaluate your diet and identify your current sources of iodine. Keep a food diary for a few days and pay attention to whether you're consuming iodine-rich foods. The best dietary sources of iodine include seaweed and sea vegetables like kelp, nori, and wakame. Just 1 gram of dried kelp can contain anywhere from 1,500 to 2,900 micrograms of iodine, which is way more than you need in a day. Fish and seafood are also excellent sources. Cod, tuna, shrimp, they all provide good amounts of iodine. Dairy products can be good sources because iodine is used in dairy farming for sanitizing equipment and as a supplement for cows. Eggs contain some iodine, especially in the yolk. As you're doing this evaluation, also pay attention to foods and substances that might be interfering with your iodine utilization. Are you drinking unfiltered tap water that might contain fluoride or chlorine? Are you eating large amounts of raw cruciferous vegetables? Are you exposed to bromine through soft drinks or baked goods? This information helps you and your healthcare provider develop a comprehensive strategy. Step 3 is to consider using iodized salt if you're not already. This is one of the simplest and most cost-effective ways to ensure adequate iodine intake. 1/4 teaspoon of iodized salt contains about 71 micrograms of iodine, which is roughly half of the daily requirement for most adults. But remember, you don't want to overdo sodium intake, especially if you have high blood pressure or other cardiovascular concerns. So this needs to be balanced with your overall sodium goals. If you're following a low-sodium diet for medical reasons, you'll need to get iodine from other sources. This might include incorporating more iodine-rich foods into your diet or considering a supplement under medical supervision. The key is finding the right balance for your individual situation.
Step 4 is to incorporate more iodine-rich foods into your regular diet. This doesn't have to be complicated. You could have eggs for breakfast a couple times a week, add some seafood to your meals twice a week. If you like sushi, you're getting iodine from the nori wraps. You could try adding a small amount of seaweed to soups or salads. Some people like seaweed snacks, those crispy roasted seaweed sheets, which can provide a good boost of iodine. One thing to be cautious about with seaweed is that the iodine content can vary wildly depending on the type of seaweed and where it was grown. Kelp tends to have extremely high iodine content, sometimes more than you need in an entire week from just a small amount. So if you're using kelp supplements or eating a lot of kelp, you need to be aware of this and not overdo it.
Step 5 is to reduce your exposure to substances that interfere with iodine utilization where possible. This doesn't mean you need to become obsessive or paranoid, but there are some reasonable steps you can take. Consider using a water filter that removes fluoride and chlorine if you're concerned about your topwater. Choose organic produce when possible to reduce exposure to brominated pesticides. Avoid soft drinks and processed foods that contain brominated vegetable oil. Limit your consumption of commercial baked goods that might contain bromine. And again, you don't need to eliminate cruciferous vegetables. Just make sure you're cooking them rather than eating huge amounts raw, and make sure you're getting adequate iodine from other sources. The health benefits of vegetables like broccoli and kale far outweigh any potential goitrogenic effects for most people. Step 6 is to consider supplementation if appropriate, but only under medical supervision. This is really important. Iodine supplementation is not something you should just start doing on your own, especially if you have any thyroid issues or if you haven't had your thyroid function tested. The reason is that in certain conditions, particularly autoimmune thyroid disease, excessive iodine can actually trigger or worsen thyroid inflammation. If your doctor determines that you would benefit from iodine supplementation, the typical dose for addressing deficiency is usually in the range of 150 to 300 micrograms per day, which is around the recommended daily allowance. Some integrative or functional medicine practitioners use higher doses for certain conditions, but this should only be done with careful monitoring. The form of iodine supplement matters too. Potassium iodide is one of the most common and well-absorbed forms. Some supplements contain both iodine and iodide, which are slightly different chemical forms. Kelp supplements are popular, but can be problematic because of the variable iodine content and because kelp can sometimes be contaminated with heavy metals depending on where it was harvested. If you do start supplementing with iodine, pay attention to how you feel. Some people experience a temporary worsening of symptoms when they first start supplementing, which practitioners sometimes call a detox reaction or bromine displacement reaction. This happens because iodine can displace other halogens like bromine and fluoride from your tissues, which can cause temporary side effects. This is another reason why working with a knowledgeable provider is important. Step 7 is to retest your thyroid function and iodine levels after a few months of implementing these changes. This helps you and your doctor determine whether your interventions are working and whether you need to adjust your approach. Thyroid function can take some time to normalize, so don't expect overnight results. But within 3 to 6 months, you should start seeing improvements in your symptoms if iodine deficiency was indeed part of the problem. And speaking of time, let's talk about what you can expect as you address iodine deficiency. The first thing to understand is that symptom improvement doesn't happen immediately. It takes time for your iodine levels to build up, for your thyroid to start producing more hormone, and for those hormones to have their effects throughout your body. Some people start feeling better within a few weeks, noticing improvements in energy or mood, but for others, it might take several months to see significant changes, especially for things like hair regrowth or significant weight loss. This is where patience and consistency are crucial. It's easy to get discouraged if you don't see rapid results, but remember, you didn't become iodine deficient overnight, and you're not going to fix it overnight either. Keep doing the things that support your iodine status. Keep working with your healthcare provider. Keep monitoring your progress. The improvements will come. It's also important to understand that iodine deficiency rarely exists in isolation. Often, if you're deficient in iodine, you might also be low in other nutrients that support thyroid function.
Selenium is a big one. Your thyroid uses selenium-containing enzymes to convert T4 to the more active T3 and to protect thyroid tissue from oxidative damage. If you're low in selenium, even if you correct your iodine deficiency, your thyroid still might not function optimally. Zinc is another important nutrient for thyroid health. It's involved in the regulation of TSH and the conversion of T4 to T3. Iron deficiency can also impair thyroid function, and vitamin D, which is actually a hormone, plays a role in immune function and can affect autoimmune thyroid conditions. What this means is that a comprehensive approach to thyroid health looks at all of these factors, not just iodine in isolation. This is one of the reasons why I'm such a big advocate for working with a functional or integrative medicine practitioner if you're dealing with complex health issues. Conventional medicine is great at diagnosing and treating acute problems, but it often falls short when it comes to these subtle, chronic, multifactorial issues like thyroid dysfunction and nutrient deficiencies. A practitioner who takes a more holistic approach will look at your entire health picture, including your diet, your stress levels, your sleep, your exposure to toxins, your gut health, all of these things that can affect thyroid function and overall health. Let me also address something that comes up a lot. Some people wonder if they should do an iodine loading test, which is a test where you take a large dose of iodine, usually 50 milligrams, and then elect your urine for 24 hours to measure how much iodine your body excretes. The theory is that if your body is iodine deficient, it will hold on to more of that iodine and you'll excrete less of it. If your body is iodine sufficient, you'll excrete most of what you took. This test is controversial in the medical community. Some practitioners, particularly those in the iodine awareness movement, consider it the gold standard for assessing iodine status. Others argue that it's not validated and doesn't accurately reflect tissue iodine levels. My take is that it can be a useful piece of information in the right context, but it shouldn't be the only thing you rely on. A combination of urinary iodine spot testing, thyroid function tests, and clinical symptoms gives you a much more complete picture. Now, I want to talk about something that doesn't get discussed enough, and that's the connection between iodine deficiency and breast health. Your breast tissue has a high concentration of iodine receptors and actively takes up iodine from your bloodstream. In fact, after your thyroid, your breasts contain the second highest concentration of iodine in your body. There's growing evidence that adequate iodine status is important for breast health, and that iodine deficiency might play a role in fibrocystic breast disease and possibly even breast cancer risk. Fibrocystic breast disease is a condition where you develop non-cancerous lumps and cysts in your breasts, often causing pain and tenderness, especially before menstruation. It's extremely common, affecting up to 70% of women at some point. Some research suggests that iodine deficiency contributes to this condition and that iodine supplementation can improve symptoms in some women. The exact mechanisms aren't fully understood, but it appears that iodine plays a role in regulating breast tissue and preventing abnormal cell growth. As for breast cancer, the relationship with iodine is more complex and still being researched. Some studies have found lower rates of breast cancer in populations with higher iodine intakes, particularly in Japan, where seaweed consumption provides much higher iodine levels than typical Western diets. Other studies have found that iodine has anti-cancer properties in laboratory settings, affecting cancer cell growth and promoting programmed cell death. But we can't definitively say that iodine prevents breast cancer based on current evidence. What we can say is that adequate iodine status is important for overall breast health, and deficiencies should be avoided. Similarly, for men, adequate iodine appears to be important for prostate health. The prostate gland accumulates iodine, and some research suggests that iodine deficiency might play a role in prostate problems, including benign prostatic hyperplasia and possibly prostate cancer. Again, more research is needed, but it's another reason why ensuring adequate iodine status is important for everyone, not just people with obvious thyroid symptoms. Let me also touch on children and iodine, because this is critically important. Adequate iodine is essential for normal brain development in children. Severe iodine deficiency during fetal development in early childhood can cause permanent intellectual disability, a condition historically called cretinism. Even mild to moderate iodine deficiency can affect cognitive development and school performance. Studies have shown that children in iodine-deficient areas score lower on IQ tests and have higher rates of learning disabilities compared to children with adequate iodine status. This is why iodine supplementation during pregnancy is so crucial, and why some countries have implemented programs to ensure that all women of childbearing age get adequate iodine. In the United States, prenatal vitamins are supposed to contain iodine, but not all of them do. If you're pregnant or trying to conceive, check your prenatal vitamin and make sure it contains at least 150 micrograms of iodine, preferably in the form of potassium iodide, and talk to your healthcare provider about whether you need additional supplementation.
For children after birth, breast milk is an important source of iodine, which is another reason why maternal iodine status is so important. If the mother is deficient, the breast milk will be low in iodine and the baby won't get what they need. For formula-fed babies, most infant formulas are fortified with iodine, but again, it's something to check. As children grow, their iodine needs increase. School-age children need about 90 to 120 micrograms per day, and teenagers need about 150 micrograms, the same as adults. Making sure children get iodine-rich foods, using iodized salt in the household, these simple steps can make a big difference in supporting their development and health. Now let's talk about some myths and misconceptions about iodine that I want to clear up. One common myth is that you can get all the iodine you need from Himalayan pink salt or sea salt. These salts have become incredibly trendy, marketed as being more natural and healthier than regular table salt. And while they do contain trace minerals that regular table salt doesn't have, they typically don't contain meaningful amounts of iodine unless they've been specifically fortified. Seawater does contain iodine, but when sea salt is harvested and processed, most of that iodine is lost. So if you're using these specialty salts exclusively, you're not getting the iodine you need from salt. Another myth is that iodine causes acne. This one has some basis in reality, but is often misunderstood. Very high doses of iodine, much higher than you'd get from a normal diet or standard supplements, can cause a skin condition called iododerma, which can include acne-like lesions, but this typically only happens with doses in the thousands or tens of thousands of micrograms, far beyond normal supplementation ranges. Some people also experience temporary skin breakouts when they first start supplementing with iodine, which might be related to the detox reaction I mentioned earlier. But for most people, getting adequate iodine doesn't cause acne and might actually improve skin health by supporting thyroid function. There's also a myth that if you've been deficient for a long time, you need to take extremely high doses of iodine to catch up. Some alternative health practitioners advocate for mega doses of iodine, sometimes 50 milligrams or more per day, claiming this is necessary to saturate your tissues and overcome long-standing deficiency. This approach is controversial and potentially risky, especially for people with autoimmune thyroid disease. While it's true that your body needs time to replenish depleted stores, this can usually be accomplished with more moderate doses under medical supervision. The high-dose approach can trigger thyroid dysfunction or worsen autoimmune conditions in susceptible individuals. Another misconception is that topical iodine, like the kind you might use as an antiseptic, can be absorbed through your skin in significant amounts to address deficiency. While your skin can absorb some iodine, this is not a reliable or recommended way to address iodine deficiency. The absorption is variable and unpredictable, and you could end up with either too little or too much. It's much better to get iodine through diet or oral supplements, where the dose can be controlled and monitored. Some people also believe that you can tell if you're iodine deficient by painting iodine on your skin and seeing how quickly it fades. The idea is that if you're deficient, your body will absorb the iodine quickly and the stain will disappear fast, whereas if you're sufficient, it will stay visible longer. This test is not scientifically valid. The rate at which iodine fades from your skin depends on many factors, including skin type, location on the body, environmental conditions, and the specific formulation of iodine used. It has nothing to do with your internal iodine status. Let me also address the question of whether you can get too much iodine, because this is a legitimate concern. Yes, it is possible to consume too much iodine, and this can cause problems. The tolerable upper intake level for iodine is set to 1,100 micrograms per day for adults. Going significantly above this level, especially chronically, can cause thyroid dysfunction. Paradoxically, both too little and too much iodine can cause hypothyroidism. When you consume excessive amounts of iodine, your thyroid can respond by temporarily shutting down thyroid hormone production. This is called the Wolff-Chaikoff effect, and it's actually a protective mechanism to prevent overproduction of thyroid hormone. In most people, the thyroid adapts to this after a few days and resumes normal function, but in some people, particularly those with underlying thyroid problems, this shutdown can persist, leading to hypothyroidism. Excessive iodine can also trigger or worsen autoimmune thyroid disease in susceptible individuals. Studies have shown that populations with very high iodine intakes, such as in some parts of Japan and Korea, actually have higher rates of autoimmune thyroid disease compared to populations with moderate iodine intakes. The mechanism isn't fully understood, but it appears that high iodine levels can increase the autoimmune response in people who are genetically predisposed. This is why I keep emphasizing the importance of working with a healthcare provider and not just loading up on iodine supplements on your own. The goal is adequacy, not excess. More is not better when it comes to iodine. Let's talk about what adequate iodine intake looks like for different groups. For most adults, the recommended dietary allowance is 150 micrograms per day. For pregnant women, it's 220 micrograms per day. For breastfeeding women, it's 290 micrograms per day. These recommendations are based on the amounts needed to maintain adequate thyroid hormone production and prevent deficiency-related problems. However, some researchers and practitioners argue that these recommendations might be on the low side and that optimal intake might be higher, particularly for breast health and overall well-being. This is where individual variation comes in. Some people might do fine with the standard recommendations, while others might benefit from slightly higher intakes. This is another reason why monitoring your individual response and working with a knowledgeable provider is so important. One thing that's really interesting is how iodine intake varies around the world and how this affects health outcomes. In Japan, the average iodine intake is estimated to be 1,000 to 3,000 micrograms per day, primarily from seaweed consumption. This is 10 to 20 times higher than typical intakes in the United States and Europe. And Japan has some of the lowest rates of thyroid disease and breast cancer in the world. Now, correlation doesn't prove causation, and there are many other dietary and lifestyle factors that might contribute to these health outcomes. But it does raise interesting questions about whether Western populations might benefit from higher iodine intakes than we currently consume. At the same time, it's important to note that Japanese populations have adapted to these high iodine intakes over many generations. If you suddenly start consuming Japanese levels of iodine when your body isn't adapted to it, you could run into problems. This is why gradual, moderate approaches are generally safer than extreme interventions. Let me share some practical meal ideas that can help boost your iodine intake naturally. For breakfast, you could have scrambled eggs with cheese, both of which provide iodine. Or you could have yogurt with berries and a sprinkle of seaweed flakes. For lunch, a tuna or salmon salad sandwich on whole grain bread made with iodized salt. For dinner, grilled cod or shrimp with roasted vegetables seasoned with iodized salt, and a side of brown rice cooked with a small piece of kombu seaweed. For snacks, you could have a hard-boiled egg, some seaweed snacks, or a glass of milk. You don't need to eat fish and seaweed every single day. The goal is to incorporate iodine-rich foods regularly throughout the week so that you're consistently meeting your needs. And remember, even if you're not a big seafood eater, you can still get adequate iodine from dairy, eggs, and iodized salt. Now, I want to talk about something that ties everything together, and that's the importance of thinking about your health holistically, rather than just chasing individual symptoms or nutrients.
Iodine is important, absolutely, but it exists within the context of your overall diet, your lifestyle, your stress levels, your sleep quality, your gut health, all of these interconnected factors that influence how your body functions. If you're chronically stressed, your adrenal glands pump out cortisol, which can suppress thyroid function even if you have adequate iodine. If you're not sleeping enough, that affects every hormonal system in your body, including your thyroid. If your gut health is poor, that can affect nutrient absorption and conversion of thyroid hormones. What this means is that addressing iodine deficiency is often just one piece of a larger puzzle. The people who get the best results are those who take a comprehensive approach. They focus on eating a nutrient-dense, whole foods diet. They manage their stress, they prioritize good sleep, they address gut health issues, they minimize toxic exposures. This is the difference between just managing symptoms and actually optimizing your health.
I also want to acknowledge that making health changes can be overwhelming, especially when you're dealing with fatigue and brain fog. If you're feeling overwhelmed right now, just pick one thing from this video to implement. Maybe that's switching to iodized salt. Maybe it's adding eggs to your breakfast twice a week. Maybe it's scheduling an appointment with your doctor to get your thyroid tested. Small, consistent steps in the right direction add up over time. And be patient with yourself. Your body is incredibly resilient and has amazing healing capacity, but it needs time and the right support. You didn't get here overnight, and you won't fix everything overnight either. One more thing I want to mention is the importance of advocating for yourself in the healthcare system. Many conventional doctors don't routinely test for iodine deficiency or comprehensive thyroid function beyond just TSH. If you're experiencing symptoms and you suspect thyroid dysfunction might be involved, you may need to specifically ask for the tests you want. Don't be afraid to be assertive about your health concerns. If your doctor dismisses your symptoms or isn't willing to do the testing you're requesting, it's okay to seek a second opinion. You deserve to work with someone who listens to you, takes your concerns seriously, and is willing to investigate potential root causes. This is your health, your body, and you have every right to be an active participant in your healthcare decisions. Let me also say something about supplement quality, because this matters. Not all supplements are created equal. When choosing an iodine supplement, look for brands that do third-party testing to verify their products. Look for certifications from organizations like USP, NSF International, or Consumer Lab. And be wary of supplements that make outrageous claims or promise miracle cures. Now, as we wrap up, I want to leave you with some key takeaways. Iodine is an essential nutrient that your body needs for thyroid hormone production, metabolism, energy, brain function, and more. Deficiency is more common than many people realize. The symptoms can be subtle and easily mistaken for other problems. But when you address iodine deficiency, the improvements in how you feel can be remarkable. The best approach is to start with testing so you know where you stand. Then work with a knowledgeable healthcare provider to develop a plan that's appropriate for your individual situation. Focus on getting iodine from food sources when possible. Use iodized salt unless you have a medical reason to restrict sodium. Consider supplementation if needed, but under supervision. And take a holistic approach to your health, addressing all the factors that support thyroid function. Remember, your thyroid is your metabolic control center. When it's working properly, everything in your body works better. You have more energy, your weight stabilizes, your mood improves, your brain works clearly. This is what optimal thyroid function feels like, and adequate iodine is essential to achieving it. If you found this video helpful and you want to dive deeper into thyroid health, I have another video that goes into detail about how to optimize thyroid function beyond just iodine. We talk about all the nutrients your thyroid needs, lifestyle factors that affect thyroid health, how to interpret your thyroid labs, and what to do if you have an autoimmune thyroid condition. So don't give up if you've been struggling with these symptoms. Don't accept feeling tired, foggy, and unwell as your new normal. There are answers out there, and very often, addressing fundamental nutritional deficiencies like iodine is a key part of the solution. Your body wants to heal. It wants to function optimally. You just need to give it the right support.
Thanks guys for watching, and I'll see you in the next one.